Okay, so today we're going to talk about the patient who can't swallow capsules, can't take pills, maybe even is a little sensitive to pills. Most of the time, I find it's more medications that they're that super sensitive to. But I happen to have one patient right now that I can use the tiniest little bit of a nutrient with her, and it works. If I use a whole capsule, it just blows her up. So there's an art to this, and so uh, again, this seems to have happened a couple of times over the last month. So I thought this was a good topic to bring up. So what do you do if you can't take supplement capsules? Okay, so I've been doing this a long time. I have a pharmacy of alternative, pharmaceuticals, nutraceuticals, botanicals, herbs, all those types of things that are all from different companies, and they're products that work. Okay, so that's my pharmacy. Somebody else may have theirs that they put together. Somebody may use homeopathy, but the bottom line is it's a cat. Sometimes I run into problems with capsules. More often, I run into capsules than dosages. So I have a kind of a routine that I follow. Now, you should be able to follow some of this. Some of it you may not be able to follow. We'll see. When we're treating people for the chronic mystery diseases of the universe, whether it's Hashimoto's or whether it's just chronic fatigue or whether it's fibromyalgia or any of those things, diet is always a good place to start. And I'll usually start with diet, combine that with specific supplementation based on certain blood testing that we do and extensive history that we have the patients fill out. And it gives us a pretty targeted way of going about it. And then currently I use more supplements than not in the beginning. And then I pare the supplements down as things are getting better. So that's fine for probably 80% of my patients. And then there's a percent of patients who they can't take supplements. Some of the reasons they can't take supplements, maybe they have had some work done on their stomach. Maybe they have a really bad like pancreas, and every time they take something, they get nauseous. Some of them can't take it because they're stressed, because they're in chronic stress, post-traumatic stress syndrome. So they have a poor, what's called vagus response. Their throat won't relax when they try to take the supplements, and so that makes it more challenging. Now, I mentioned the diet because if you can figure out your diet, and by the time a person gets here, they usually haven't been able to figure out their diet. But if you can figure out your diet, let's say you go on an autoimmune paleo diet and that calms everything down, that's going to help your supplements work a lot better than just throwing a bunch of supplements in there while you're eating junk or while you're eating stuff that's flaring you up because you got sensitivities. And I mention that because sometimes I just put people on the diet first. We figure out their sensitivities. We start to and we leave them on that for a little bit. Maybe we'll use some protocols to increase fiber in a lot of the cases, and you can increase fiber without using supplements, and by making further tweaks to that. And that a lot of times will alter the chemistry of the stomach, pancreas, and gallbladder so that they can now start to take pills, like capsules. When I say, I'm talking about like herbs and botanicals. So that's one thing that we see. The other thing, which is a lot more logical and commonsensical, is, and I'm in the process of continuing to develop this, is trying to find products that are as effective as the ones that I have, that I use, that also are either powders or also are either liquids or are tablets that are chewable. For example, I use a GABA product that is chewable. The other product I used were capsules. People couldn't swallow them, but these chewable ones, they're good. They taste good. Digestive enzymes. I have a product that I love. That's a digestive enzyme hydrochloric acid combination. But but you got to take 2 pills 3 times a day. And so now we have some other ones from another company, quality company. I've used them. They work wonderfully, so you can chew them. So there's that. Then there is the you can possibly start to separate from the liquids and separate from the chewables and the powders. You can get to the level of investigating those, and if those are still like giving you a little bit of a because you should be able to swallow those. Okay, now if it's that you're taking those and they can't, and you're still getting, let's say, a reaction from them, then you want to minimize the dosage. Sometimes you can take so little, and when you take, let's say it would be one of these digestive enzymes tablets that I just talked about. Sometimes you take 2 of these 3 times a day. So maybe go down to 1, maybe go down to a half, maybe go down to an eighth and of 1 capsule. And your system works in such a way that if you're able to swallow it and your system is rejecting it, it's because your system is not seeing it as something that should be there right now for a variety of reasons relative to your poor digestion. And so if you do it like a little tiny bit at a time, then there's parts of your inside of your intestines that'll start to recognize this, where the immune system is, as okay, and then you can dose it up. Now, the thing with that is it takes a long time. Most of my patients I don't treat that long, not for what the types of conditions that they come in here with. I might treat them 3, 4, 5 months, something like that. But if you're having to take a week to be able to get, or 2 or 3 to get one capsule assimilated for one part of, let's say, a broken down digestive system, which you're going to have something maybe for your stomach, maybe something for your pancreas, maybe for your gallbladder, maybe you're going to have something for your leaky gut. If you have to keep layering them in like that, I mean, what I do is I just give the person the instructions how to do that and tell them, let's not meet again until you've been able to do this with these 3 supplements. That could take a while, but with these types of conditions, you don't really have much of a choice. If you're like my patients, you already tried everything else, and if a person can't eat foods, then we have to figure out how to get them to eat foods, and that's what we do. If a person can't take supplements, I don't, it's kind of hard to know where to go with that. You have to kind of depend on, hopefully, that figuring out a person's diet, figuring out their food sensitivities, is going to go a long way. And sometimes it does, sometimes it doesn't. So these are the realities of treatment. These are the realities of doses, especially when you're working with non-drug modalities, like when you're working with diet, lifestyle, things of that nature. I mean, nature doesn't bend. You have to get rid of the foods that are making you sick. You have to, generally, a lot of times you have to take something to help the broken down tissues in your organs to heal. And obviously, I think that it's preferable to be doing non-toxic, non-drug types of things whenever possible. And so even though it may be tedious, it's you have to kind of hang in there. And the big problem for maybe you might be, you have all these things going on. Which supplements do you take? For me, it's just a logistical problem. I know where we need to go. I know what needs to happen next, but when I can't get that part under control, I know I'm not going to be able to get any farther with that case. And so I have the ability to maybe coach that person through that tough time. But it also takes more visits, which is, it's not optimal for some folks to have to take 20 visits instead of taking 6 or 8 visits. And so that's the kind of some of the things you can take into consideration if you know you want to take supplements, but you don't know You take them, you don't feel well. And another thing, one last thing, I'll just say, you can look up online if you're somebody who can't swallow pills. You can look up online. There are simple exercises to help you to calm down that stress response and let that, it's called the vagus nerve, that lets it relax. Some of them are as simple as gargling. Don't laugh. Some of them are as simple as putting a tongue depressor on your tongue and forcing yourself to gag. Some of them are as simple as singing loudly in the shower. I'm talking like so your neighbors can hear it, like two houses down. And these are not to be shined off. For me, it's always back to basics. It's always keep it simple. It's always simple is better. These things work. You can do them for a while. And most of my patients are shocked. Deep breathing exercises along with that. Most of my patients are shocked when it works because it seems stupid to them. But that's how you stimulate your vagus nerve and strengthen it so that it relaxes so that you can swallow pills. I think it's everything I know on that subject at this point in time. If I learn more with all the people that are coming to me that can't take pills, I'll do an addendum and fill you in. But this is how I handle it here in the real life where the rubber meets the road, where I got sick people sitting in front of me. These are the tricks that I use that seem to be pretty successful.